is less than 60 years old. So who is the population? Yes, elderly patients with end-stage heart failure. And the intervention? Transplant, yeah. And the comparison, what two groups are we comparing? Right. And the outcome that we're looking at? Yeah. Morbidity and mortality prognosis. And is there a time frame in this question? 10 years. And what domain would you say this question is from? Prognosis. Correct. Good job. I wanted to highlight that there is, when you're doing a literature search, there's a hierarchy of evidence that you need to take into consideration. At the very top of the chain are systematic reviews, and also, it doesn't say it here, but meta-analysis. That's where you should start if you can get your evidence from systematic review or meta-analysis. That's wonderful. Not all questions are going to lend themselves to that, or maybe there's not enough research and you may not be able to come across that. But a systematic review will take randomized controlled trials and pool them together for you in a review to look at. A meta-analysis is a type of systematic review that will take data from several different trials that have the same outcome measures and pool them together to increase your sample size. And you always want a higher sample size. And then moving down the chain, you have randomized control trials where the subjects are allocated randomly to groups. Non-randomized control trials where there's a comparison group but they're not randomized. And then at the bottom of the chain, you have a case report or case series. And here there's no comparison group. So I have a video on hierarchy of evidence to kind of clarify.
This tutorial will explain levels of evidence based on research study design, so that you can find the best evidence for your practice using a database. It was developed by the Physiotherapy Association of British Columbia for PABC members and for members of the Ontario Physiotherapy Association. You may be wondering why it is important to learn about levels of evidence. It is important because of how it ties into evidence-informed practice and how it can aid in your search for information. Evidence-informed practice aims to apply the combination of 1, the best available evidence, 2, your clinical expertise, and 3, the patient's values and expectations to clinical decisions. Generally, the higher the level of evidence, the more comfortable you will be in using the evidence in the literature to guide your clinical decision-making. So distinguishing higher levels of evidence from lower levels is an important skill in providing evidence-informed practice. This image shows the pyramid of evidence based on the research study design. When we are looking for the best evidence available, we can consider what types of studies have been published. At the bottom of the pyramid, research may involve investigations in the lab with test tube or animal studies. Based on the amount of research that already exists and the specific questions that researchers are trying to answer, there are other types of study designs. These may include ideas and opinions, randomized control trials, systematic reviews, and meta-analyses at the top of the pyramid. Generally, the higher up on the pyramid, the more rigor there is involved in the research, and thus the greater the level of evidence. However, the highest level of evidence will not be available for every topic you're searching. Typically, for a rare condition, a very new therapy, or type of treatment which ethically can't be randomized, a case study found midway up the pyramid may be the highest level of evidence available to you. For many diseases, conditions, and therapies in healthcare, higher levels of research evidence are available. This may include RCTs, systematic reviews, meta-analyses, and practice guidelines. When this research has been published, you can start your research by looking at the top of the pyramid first. Let's review the different types of research studies. The randomized control trial, or RCT, is a very high level of evidence. It is distinguished from other types of studies because participants who are very similar at baseline are allocated randomly to one of two groups. While one group receives the standardized intervention, the other group, the control group, doesn't receive the standardized intervention. Instead, they receive usual care or placebo intervention instead. As we will see in part 2 of this tutorial, the quality of an RCT may be determined by one of many different appraisal tools. A wonderful time saver for clinicians is to try and find a systematic review or a meta-analysis first. As we will see, these studies save you from reading 20 different RCTs to answer a clinical question, because they systematically and rigorously combine the results of a collection of previous articles published on the topic. Another research study with a high level of evidence is a systematic review. A systematic review methodically searches for, assesses, and summarizes studies according to predetermined criteria. Most often, these studies are RCTs. However, systematic reviews can also include a meta-analysis. A meta-analysis combines the results of several studies that address a set of related research hypotheses. The difference between a systematic review and a meta-analysis is that a systematic review combines the results of a group of previously published articles that use different outcome measures, while a meta-analysis combines statistically the results of a group of previously published articles that use the same outcome measures. A practice guideline is a systematically developed statement that helps practitioners and patients with decisions about appropriate health care, such as how to treat fibromyalgia. It may be multidisciplinary in nature, such as osteoporosis guidelines for MDs, which might include exercise guidelines relevant to physiotherapists. Most importantly, a practice guideline summarizes literature in order to guide best practice. It may or may not have used a rigorous methodology, such as a systematic review, to determine the recommendation. In addition, it includes opinions and usually a consensus process. In this tutorial, we have reviewed levels of evidence and how this can help your evidence-informed practice. The next tutorial will demonstrate how to use the Physiotherapy Evidence Database, otherwise known as PEDRO, to find the highest levels of evidence. Thanks for watching. Please check our other tutorials available through our YouTube channel and website.
I just thought that was a good video that shows you the different types of evidence and the hierarchy. So this is Jacqueline Castig. She's our medical librarian here at Tampa General, and she's going to talk about what resources we have in the library for you to search evidence. She's going to do a practice search with PubMed to show you how you can use it. Thank you.
Okay, so I am one of the medical librarians here. I've been here about 3.5 years. I got my master's in library science from USF, and I also work as a librarian in Hillsborough County and Largo. The medical library is located on the first floor in the East Pavilion between medical records and the foundation office. It's available to all staff 24/7 with a badge. We are staff, the librarians are there from 8:30 to 5, Monday through Friday. But it's open 24/7 for people who want to use their computers. We have a printer, a copier. You can use the computer to check your email, do your e-learnings, or if you just need a quiet place to study or do your literature search, we are available for that. We also offer assistance with helping you with your literature search skills. We can help you with your citation list, reference, formatting, anything you need help with for your research. We can help you. If we can't, we can definitely point you in the right direction. So I'll talk a little bit about PubMed, which is what we use, and it's kind of considered the gold standard in a literature search because it's kind of a one-stop place you can go for all of the peer-reviewed medical journals, articles that you can find. Well, I'll go to PubMed first. Right now, we don't have a password to the database that we can give out to staff, but the library staff does have access to full text articles. So when you're doing your search, anything you find in PubMed we can get for you. If you're looking in other databases or on the internet, we can most likely get the full text for you. But if it's in PubMed, we definitely can. Once you find articles, you can email us, call us. We have a page on the portal you can put a request in, and then we can either print the articles out for you or email them to you. Usually, if we have access to the articles, we can get them for you in 5 or 10 minutes. If we have to ask our partner libraries to send us copies, it could take a day or two, but it saves you the $30 to $50 that publishers generally charge you per article. So it's definitely a service you want to take advantage of here. If you're having a tough time finding abstracts and articles, we do offer a literature search service where we will do the search for you and get the articles and then put them out or email them to you. But we really want to help you get in the habit of doing this search yourself and improving your skills, because it's something that you'll use a lot. And especially when you start doing it, you'll see how easy it is, and then you'll be looking everything up. So I'll tell you a little bit more about PubMed, and then I'll do a quick search to just kind of show you around so it doesn't look completely foreign to you when you do a search. Has anybody used PubMed before to do a search? Okay, so you might know a little bit. I'll show you some tricks that might help you get some better results. So PubMed is an archive managed by the National Institutes of Health and the National Library of Medicine. It contains citations from almost all the peer-reviewed health sciences journals, both in the U.S. and in other countries. So anything you look up in here is going to be from a peer-reviewed journal. The citations, currently indexes, as you can see in this little box here, more than 24 million citations. And when I first started here, it was 22 million, so you can see how many more are getting added all the time. The citations include abstracts, full text articles, poster presentations, letters to the editor, practice guidelines, and other items. There's also a lot of free articles you can get in PubMed. Even though we don't have a login for it, they're free to the public. Anyone who goes on pubmed.gov, you'll be able to get them. And more are being added all the time. These free articles are being added to PubMed Central, which is a sub-archive of PubMed that publishers voluntarily add full-text articles to. Typically 1 year after they get published, but sometimes you'll find them in there before they get published in print or around the same time. So in the future, it'll be easier to get full-text articles for free. Anyone can get them. You want to Okay, so I'll go ahead and do the sample search. Say you wanted to find out about hospital readmissions. I'm just going to put that in and see what happens. So we get over 12,000 results. That's a lot to look through. And probably most of these aren't going to be exactly what you want. So one trick you can do to make sure you're getting more relevant articles is to put your phrase in quotes so that the search engine that you're using, most of them will recognize this, and PubMed or other databases also. When you put it in quotes, it tells that you want these two words together, not here and then over here talking about something else. So if we do that, it goes down to just over a little over 1,000. So that's a lot easier to look through, and they're probably going to be more relevant to what you're looking for. The only problem with that is that it depends on the topic you're searching, but you might miss some that maybe were about hospital readmissions, but for some reason they didn't have those words together. So that's why doing your search, the hardest part is just trying different words, trying different combination of words, synonyms. It's just your first string of terms that you put out for your search are probably, it's not going to be your last one. You're probably going to have to try different words. So in this one, we want to narrow it down a little more. So if you knew you wanted, you're really interested in readmissions with cardiovascular patients, we could put that in instead. So you could put cardiovascular, and you put the and in all capitals. That signifies that you want to make sure your article that comes back has this word and this word. Both of them need to be there. PubMed's pretty good about recognizing that without you putting and, but it's just a good habit to get in, especially if you're doing an internet search or something. It will recognize this as well. Okay, so cardiovascular, and readmissions. No, there's 350.